Hi everyone, my name is Holly Limbrick. I'm an occupational health physio at Vita Health Group, and today I'm going to be talking to you about the importance of making healthy lifestyle choices when managing back pain. So I'm going to be starting with stress. Now, stress is something that we can all relate to in some form or another, whether it be major life changes or the stresses of everyday life. A little bit of stress can be good for us. It drives us to change, achieve, learn, and progress in life. However, chronic stress that goes on for weeks or months at a time without resolution is quite bad for our health, and it actually increases our risk of developing chronic diseases. So here's why. The stress response is a physiological adaptation to get us away from danger. Hence, it's sometimes referred to as the fight or flight response. It results in the release of stress hormones called adrenaline and cortisol, and these increase our heart rate, our blood pressure, the clotting ability of our blood, the blood sugar levels, and the inflammatory response. So all of this is designed to optimize our muscle performance to help us run away from danger and prime our body for any injuries that occur in the process. However, the problem lies in that modern day stressors do not actually require us to run away from them. And in fact, our activity levels are often even more reduced in times of stress, as we're substituting extra hours in the office for our usual exercise routines. This means that the physiological response is not being used up appropriately by the body, and the resulting increased blood pressure, blood sugar, and inflammation can increase our risk of cardiovascular disease, diabetes, cancer, and more. With regards to back pain, the increased inflammation caused by stress can increase pain levels and slow down healing. Stress can also upset the balance of neurotransmitters in the brain that would normally help us to cope with that pain response. On a secondary level, stress often makes us reach for familiar coping strategies such as junk food, cigarettes, alcohol, and unfortunately these things only compound the problem further by adding inflammation and toxic load to the body. This reduces the nutrient and oxygen supply to the tissues and can reduce the body's capacity for healing. Lastly, pain in itself is a physical stressor on the body. So we can actually find ourselves stuck in a cycle of more pain causing more stress than causing more pain. So managing stress is really important, and everyone will have different strategies that work for them. Exercise is a fantastic way to de-stress, as it's actually what the stress response was designed to facilitate. Breaking up your day with short bursts of activity will not only reduce your stress, but will also help you manage your back pain directly by breaking up prolonged sedentary activities, ensuring a good supply of nutrients and oxygen to your tissues necessary to help them heal. And it's going to prevent the buildup of weakness, stiffness, and fatigue from repetitive postures or activities. Other strategies to reduce stress aim at reducing the fight or flight response and increasing the opposing system, the rest and digest response. These strategies include deep breathing techniques, mindfulness, relaxation, laughter, and limiting your exposure to technology, news, and the media. So next I'd like to talk about diet. We all know that a healthy diet is really important for maintaining our general health, but it's also really important for managing pain. The same basic rules apply here. We want to make sure we're eating a diet that's rich in fresh produce, and cooking from scratch is a really easy way to make sure that we're avoiding those additives such as salt, sugar, harmful fats like saturated fats, trans fats. But by cooking from scratch, we're also maximising the nutrient content of our food, which can be diminished through the processing of food. Maintaining a healthy weight is also really important for pain management. Not only does excess weight put more physical strain on the structures of the body, But excess adipose tissue, excess fat tissue, also produces a lot of inflammatory chemicals in the body, which can ramp up that pain response, and they're also very damaging to our general health. Other dietary strategies for managing back pain are including a source of protein with every meal, as protein is really essential for rebuilding and repairing the body after injury. Your sources of protein include meat, fish, beans, lentils, eggs, and tofu. You could also consider increasing your intake of oily fish, as this contains a substance called omega-3, which works as an anti-inflammatory agent in the body. Lastly, you want to make sure that you're eating lots of different vegetables, at least 5 a day, but up to 7 or 10 a day is even better. And these contain lots of phytonutrients that reduce inflammation and pain, as well as supporting our general health by neutralizing toxins and boosting our immune system. So lastly, I want to touch on sleep. Sleep is the time that our body is resting and repairing. So achieving 7 to 9 hours of good quality sleep per night is really important for healing and pain management. Lack of sleep can also increase our stress hormone production, and it's been linked to several chronic diseases, including obesity, cardiovascular disease, diabetes, and mental health conditions. There are several hacks that you can use to achieve a good quality night's sleep. You want to make sure that your sleep environment is comfortable. It wants to be cool, dark, free from noise, and you might want to consider using an eye mask, earplugs, or blackout blinds to help minimize any disturbances. A good bedtime routine is also important. Trying to go to bed at the same time each night, with around 2 hours of winding down time before bed. During this time, you want to repeat similar non-stimulating activities, such as having a bath, reading, or writing a diary with some thoughts of the day. And creating a routine means that your body just knows that it's time to wind down and time to sleep. In that 2 hours before bed, you should also limit your exposure to blue light. This is the light that's emitted from electronics, phones, computers, and it actually inhibits the release of our body's sleeping hormone called melatonin. Other tips include consuming caffeinated drinks before lunchtime, so you have a chance to metabolize that caffeine during the course of the day before you're trying to go to bed. You also want to avoid eating large meals 2 hours before bed and limiting your alcohol intake before bed. It might help you feel like you can drift off a bit quicker, but alcohol will actually disturb your sleep quality later on in the night. Okay. So that's the end of this short presentation about the importance of healthy lifestyle choices when managing back pain. I hope you found it interesting and can leave with some inspiration and useful tips to clean up your own lifestyle and manage your pain better. Thank you for watching.